Aloha everyone, and thank you for joining the COVID-19 Public Health Action webinar, Clusters and Case Counts Surviving the Second Wave with Lieutenant Governor Dr. Josh Green. My name is Steph Moir, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, we want to go over some Zoom housekeeping. For our COVID webinars, we will not be offering any continuing education credits, and all webinars will be recorded and are available on the Hawaii Public Health Training HUI's YouTube channel. Also, for today's webinar, we will not be taking questions via the chat box or the Q&A, and I do want to thank everyone that sent in their questions ahead of time. Now, it's my honor to introduce you to our guest speaker today. Lieutenant Governor Dr. Josh Green is a local doctor who has spent his life's work as a family physician and ER doctor in rural hospitals and clinics on the Big Island. Josh served in the Hawaii State House of Representatives from 2004 to 2008 and in the Hawaii State Senate from 2008 to 2018, where he chaired the Health Committee and Human Services Committee. In 2005, Josh met his wife, Jamie, and together they are proud parents of Maya and Sam. In response to COVID-19, LG Green was appointed to help lead the state's response to the coronavirus as a liaison between the administration and healthcare community. It is my honor to turn it over to LG, Dr. Josh Green, for his update.
Hey, thank you. Thank you, Steph, and thank you, Trish. You guys are fantastic. And it's a pleasure to be with you. And without your kind of organized leadership, it would be impossible for me and others to really share where we are and to actually learn from the many questions and suggestions that do come in from these forums. So thank you for doing this. It's timely, more timely than you know, actually. So let me dive right in. We have 173 cases today, taking us to 2,763, an active caseload of 1,334 right now. So because of this, you're going to see some significant changes almost imminently. Over the last, say, 72 hours, we've begun to see a surge in our hospitals. And I know this is very concerning to not just young people or people in public health, but to people who actually work as clinicians, people who have kupuna in the state, who know that that would be a great risk to them to see active spread go without some significant change in policy. So we really have seen a big surge. We have, at this moment, 127 out of 244 ICU beds occupied, although we are seeing a surge, especially on Oahu, and more than one of our hospitals have approached maximum capacity. One of our primary hospitals is actually going to expand an additional surgical ICU or medical ICU. We have still had good success keeping people off of ventilators for the most part. Only 73 people in the state are on ventilators. 13 of those individuals are with COVID out of 459. That's 16%. Still, you're going to hear tonight that if we don't change the trajectory of COVID-19, we will fill our hospitals, particularly our ICU beds, by month's end, which is a very, very dangerous place to be. Because of advanced work, excellent hospital preparation, we do know that we can expand our ICU capacity about 30%, which means we can get up to about 300 ICU rooms. Most of that's by changing the way we approach our operating rooms, turning them into intensive care unit rooms if necessary. And of course, they can accommodate ventilator if necessary, like we always do. But things are changing fast. In the last 24 hours, we did 2,389 tests total, and 7.2% of those came back positive. Now, if you recall, when we were just going modestly through the COVID crisis, we only would get 1 to 2% of our people testing positive. Now it's 7%. And an alarming small piece of data came to us 2 days ago at KKV. When they did testing of 51 individuals, 26 tested positive in our Pacific Islander community. We know that that is very dangerous because when you start seeing large, dense populations of people testing positive, we know that there's very comprehensive community spread going on. And all of these numbers and facts lead to the conclusion that we're going to have to lock down and lock down soon. So I can only speak candidly on on some of these topics. I cannot share a couple details. You'll hear them later this afternoon or tomorrow morning. But I will say this: expect a very significant announcement from the governor and mayors that we're going to take a lot of added precautions for the next 30 days. It's very important because that has been successful to flatten the curve. Now, we've talked about contact tracing and testing as an important part of the response, and it is very important. It's not the only one. The Department of Health needs some additional support, and I know many of our friends here on this call have looked into this and offered their services. We will need you in time. We do know that we have to enhance our capacity to over 400 people to contact trace and test. It has gotten pretty much out of control as far as our ability to do that job. Again, though, as Director Anderson, Bruce has said many times, the most important thing, and he's right about this, is physical distancing, wearing a mask, washing our hands, not being out when we're sick, and not grouping. Those are the most important things that we can do. And I'll say them again: wearing a mask, staying 6 feet apart or more, physically distancing, washing our hands, staying home when we're sick, and not having groups of greater than 10. That essentially knocks the virus out. But what we've been witnessing statewide, we saw it quite terribly this last weekend, is outdoor gatherings have been really large. That, combined with a few indoor gatherings that unfortunately spread the virus, I'm speaking about funeral services now, where over 70 people did spread the virus that way. Probably some spread additionally from restaurant use, bars, and gyms. All of those settings are just higher risk. I don't mean to vilify anybody, but those risks are risks that now are going to overcome our healthcare system capacity if we don't do something. And so, in spite of the fact that we have the lowest mortality rate in the nation at 1.8 per 100,000, in spite of the fact that we've had the lowest prevalence, we are seeing a surge that is significant enough that our somewhat limited healthcare system, as far as size and scope goes, is going to require a significant change. So this will mean a lot of things, which I'm sure we'll address in this hour. It will have an impact on our school openings, you can be sure. It will have an impact on opening of trans-Pacific travel and tourism, for sure. It will extend some of the economic hardship, but we are poised to definitely provide extensions of unemployment. We certainly will continue to have a moratorium on evictions, because we don't want people to become homeless and deal with the issue that we've dealt with together for many years. And most importantly, we also know that if we can weather the storm to the time when we get to a vaccination, which will come, and I will be standing right there with you, supporting prevention in all ways, then we get through this with the least amount of harm to our beloved families. So this is really where we're starting, and I look forward to sharing much more. But I think maybe in case today, of all the questions you have, I'd like to really kind of try to be succinct and answer rapid fire questions, because there is really probably a lot to address. And I'll just finish with: expect a major announcement later today or tomorrow, adding significant restrictions in the course of social gatherings. Expect us to lock it down, so to speak. We'll clarify exactly what that means and what the rules are. You can, I assume, still go to work, but we're going to have to minimize all social gatherings that are outside of our own household for 30 days. That's the only way we're going to get through this without spread. And we will be happy to reward ourselves if we can get back down into the teens or 20s for a number of cases as we go forward with the rest of the year. So again, thank you for having me. Trish, especially, you persistently hassle me, which is wonderful. And you've been a very good health leader. I want to say that to you and Stephanie and others. You have been a special part of the healthcare system, and I appreciate that you continue to reach out to me, and I'm honored that you would include me today.
Thank you so much. Well, we're honored to have you join us again, and thank you so much for taking time out of your schedule to be here. So I do want to say that we did get many questions via email and via social media, so I do want to apologize in advance if we don't get to your questions today. We do want to start off with our first set of questions in asking, are we seeing this second wave that has been mentioned?
Yes. This is definitely the second wave. We had hoped to have just small little humps like this to get through it. We ended up having a very large second wave. We're on the way up right now. We're not on the way down. we'll be on the way down in about 2.5 weeks if we successfully mitigate things by shutting it down.
Okay. And I know you mentioned the shutdown. Do you know, or will we know, if they'll be reinstating the inter-island quarantine again?
I do know.
Cannot share.
I would say this. I think it's highly likely, based on the tone of the mayor's conversation, that the 14-day inter-island quarantine will likely be part, but we're going to get together again at 2 o'clock today to discuss that further. What is likely, for broad understanding of what we're likely to see, is Oahu go to an orange state, or the safer at home. The neighbor islands have not had a surge of cases, so if they choose to, they can remain in the act with care category, which is where we've all been. But having said that, you have to really use the lowest common denominator, or I guess more significant lockdown common denominator for travel between islands, and that would necessitate the 14-day quarantine.
Okay. And I know you mentioned how many ICU beds are currently occupied, and some of our hospitals are starting to be at capacity. So what measures are being taken by the medical community to better prepare for this? Hopefully, we don't want to see a continued surge, but if there is a surge, what are hospitals doing to get ready for this?
Thank you. They're preparing secondary intensive care units so that they can have a whole nother unit developed for intensive care purposes. They're also expanding their capacity. They're very likely going to begin to suspend elective procedures, especially when the lockdown order goes into effect for 30 days. All of that's meant to, to lower the overall pressure on the intensive care unit space. We also will move services and professionals if we have to. But at this point, we have not had to do that. So we'll call on our friends from the neighbor islands to provide healthcare and support if we have to staff extra beds.
Okay. So I know you mentioned that we're looking like we're going into this lockdown, and a question that's been coming in is, do we know that outdoor gatherings have been lowered to groups of 10, but is it safe to do that and have sporting events with up to 100 people? So
that's going to stop. So I would expect sporting events will be suspended for the 30 days. And I do expect even that gatherings of 10 are going to be suspended almost imminently. Only people in our household should gather, and for a short period of time. Really, 2 to 4 weeks was the debate. I think 4 weeks is where we're going to settle, because you don't start seeing the effects of a change actually for at least 5 to 7 days. Mm-hmm. So it'd be better to do 4 weeks.
Okay. We did get a lot of questions relating to schools and schools reopening, and it sounds like things might be changing given the potential lockdown that we might be seeing. So if students are expected to return to school in 2 weeks, what are your thoughts and recommendations on that?
I would expect that will have to be delayed at least 2 additional weeks for Oahu at least. The neighbor islands would have the capacity to come sooner, but I think having an uneven system is probably not prudent. It'll probably cause chaos. Mm-hmm. I have not yet spoken to the superintendent. I'm sure that we'll brief her almost imminently as soon as I'm done speaking with you guys, and then the 2 o'clock meeting.
Mm-hmm. And even given that delay in schools opening, whether that's a few weeks or a month from now, are Hawaii schools ready for face-to-face instruction? Students have already lost so much classroom time. So are they ready? And is there support available for parents who need to go back to work or continue working?
Well, I do think that given the amount of work they've spent on putting protocols in place, they probably could do okay had we not had this surge in face-to-face classrooms. The idea was really to thin out the number of kids in classes so that we didn't exceed 10, essentially classrooms of 10. That was a goal. This changes that a little bit. I do think we're going to end up having to do distance learning for at least the first month. They may have to adjust slightly. I know a lot of schools were already planning for that, so the curriculum may have to go that direction. What I've been sharing with parents and teachers and everyone, mostly families, is we're going to have to understand that this 6-month period, the second half of 2020, is going to be unlike any other, and our expectations will have to be just reasonable. And sometimes it's difficult to educate people, and it's going to be difficult to go to work. So every company and business will have to be understanding if there's a dad or a mom who needs to be with their child and do distance work. Certainly, we had a lot of parents that were already worried about going back even without the surge, although this surge has been going on for about 10 days at least, and a lot of people were wondering if we were ready.
Mm-hmm. And when schools reopen, I know we don't really know when that is, but do we, or is it enough to say that the teachers will be safe given only masks? We're seeing schools on the US mainland reopening and seeing what's happening there, and just a lot of questions asking safety procedures that should be put in place to ensure that our keiki and DOE staff are safe when they do return to classroom learning.
It's questionable. I think that we have to be able to take temperatures of every kid and faculty member, educator. We have to be very understanding if anybody doesn't want to come into work if they're feeling under the weather, or come to school if the kids are sick. If you distance, if you socially distance and have, a legit 6 to 10 feet between oneself and a student or a coworker, and you're wearing a mask, your risks are very minimal. But I would not begrudge anyone, let's say any teacher that's over 60, if they want to be a part of the distance learning curricula, I think it's completely reasonable. And honestly, if anybody makes that decision, it's something that I would be understanding about. Mm-hmm. I would not have a problem personally becoming a teacher and doing that. I mean, I'm still going on my ER shift this weekend, so I feel comfortable as long as I'm wearing a mask. And, I, of course, put face guard on and even gown up if I'm worried about a case. So I'm still providing healthcare. I think it can be done safely in the education setting. Now, of course, teachers don't have as much PPE. They don't have all that stuff around on them. On the flip side, of course, 100% of my patients are, possible risks. And in the school setting, it will be substantial, but not quite the same.
Mm-hmm. Thank you. So the next topic that we're going to move on to is tourism, and lots of questions coming in about opening up on September 1st. Is it safe to assume that this will get pushed back given the information that you've shared with us already today?
Yes, I think that there's little doubt that there will be pressure to move that back at least 2 weeks, if not a month. It's interesting because it really has not been traveler related, but being open and accommodating travelers, even if we had people coming, if restaurants are closed on Oahu, if we can't open beaches and beach parks, it doesn't make a lot of sense, for one thing. So I haven't seen the final recommendations yet, but I think probably you're talking about a 2-week delay of schools further, and then a month delay of travel. I mean, it kind of resonates. That way we still have a month in between activities, and if we can get our case count down very well, then we're good. If we can't, we'll be like everyone else. I will say this: a lot of people think that having travel open is going to be a panacea. Well, the likelihood is we're going to get pretty low traveler numbers at the moment, given how much COVID is being spread around the world. Eventually, we will get massive numbers of people coming back to Hawaii, probably more than we want, because when the virus finally subsides, though a lot of people will have been hurting economically, a lot of other people who stayed working have saved all their money. They have not been able to go out. And also, Hawaii represents a symbolic escape from normal life. And I feel pretty strongly that if people think they can be safe on a plane, they're going to try to be here. And I bet you even for longer vacations. That'd be my guess.
And even with the delay in, or the possible delay in opening up the state for travel, question around the 14-day quarantine versus getting the negative test. And has the state considered plans to use a designated quarantine hotel, for example, for arriving visitors?
Yes, it has. And that's actually, I really appreciate that question. That's the right thing to do. Have a designated quarantine hotel in each of the counties so that there's no question that we can then actually enforce the rules. Because right now, it's kind of, it's a non-secret that you just can't do it. Enough people still go to Airbnbs, enough people still pick and choose a spot to stay and then are out. Overall, it's been good. I mean, overall, we've been able to contain the numbers very significantly. Remember, we're down 98+%. However, when people are breaking the quarantine rules, it's even more evident. So we will have those facilities. We've already contracted. Department of Health has done that work with a couple out there, and I believe that's the way. The better thing would be to get through a month of this and also see the numbers drop significantly on the mainland. That would be quite good. And then not have to be quite as worried. The idea of the pretest, of course, is to decrease by about 70% the probability that anyone is an asymptomatic carrier, or if they, maybe were sick, we get a confirmation that they're no longer actively ill with COVID-19. So I've always felt that was a safety measure and a forced act of personal responsibility is another way to look at it.
Mm-hmm. And similarly, thinking about testing those that are wanting to travel, what do you think of the Oceanit's Assure 19 10-minute test for use at the airport for arriving visitors?
I really like the idea. They're going to work aggressively to get approval and to make this thing work. I have a personal high regard for Oceanit and Dr. Sullivan and all that they do. I'm a fan, and I find him and his team to be some of the most intelligent people I've ever met. So I expect they can pull that off. There's a lot of these quote paper tests that are out there that can more quickly activate, and they'll be good for broad screening. Actually, they're not going to be meant to be used in the intensive care unit, or if I'm seeing a patient that's very sick. But if you're talking about, say, a whole school that you need to sample, or a police station or a fire station, or a hair salon where somebody came through and was sick and everyone just wants to get a quick test, all these things, they'll be very good.
Mm-hmm. And sticking with testing, we know that you've been really vocal about widespread testing and contact tracing as keys to controlling the spread of the virus. What can you share about the data on clusters being reported, and is the level of reporting enough?
The clusters have been problematic. The Department of Health has done its best for the most part to chase them down, but the volume of cases simply got way out of control for them to fully contact trace. And we have not had enough full-time contact tracers. I don't want to be overly critical or argumentative on a day when everyone's trying to kind of row the canoe in the same direction. But we know that you need about 30 per 100,000 people, 30 tracers. Even if it seems like overkill, that's what we got federal funds for. And in order to be kind of outward facing and dealing with not only the cluster that occurs, but then all the community around it, and making sure that you have a culturally appropriate way to get into the community and have extra conversations and not burn people out, we do need to do a lot more. Also, you can only describe so many clusters when you have this few people working on it. They have only a couple dozen people full-time at present, and we really need hundreds. It's a big lift, and we'd like to help out in whatever way possible. That's why the National Guard is now going to be involved, why there's been lots of offers. And anyone who went through the course, I hope that they will reach out directly to Department of Health and just say, look, I'm here and I'm ready. I know that, people have been told to wait for a call, but it's okay to be a little proactive nowadays.
And you just mentioned how when utilizing contact tracers, we want to make sure that they are culturally ready to be reaching out to these communities that we're seeing clusters in. And we've been hearing anecdotally that there's some mistrust of contact tracers. And we know that community health workers are trusted members of communities. Do you think that we will see the opportunity for community health workers to be utilized as contact tracers?
Yes, I recommended that actually a couple days ago. I think that is the best way to go right now, which is to have the counties, although it'd be fine if it's the state also, have the counties use their CARES money to enhance the amount of money that's going to community health centers, and have the community health workers do it and be completely embedded in the teams and out there with clipboards and conversation and and data gathering directly in the community. I think that we could probably multiply our number of our number of contact tracers maybe by 4 or 5 times right away. And we should do that. That would be a great use of our personnel. Also, it enhances the money a little bit. Contact tracers have tended to get paid about $22 an hour, maybe. It's not a ton of money, but it's not nothing. And often community health workers have been paid less than that. It's a good opportunity to help support a very valued discipline.
Thank you. Speaking about clusters in communities, can you comment on the recent multi-generational clusters reported and what actions are being carried out to keep family members sheltered together to avoid spreading the virus?
That's the grand question, right? Can you keep family members together and expect spread to not occur? It's very difficult. If people are more elderly, it is rough because often you don't want to separate people when they're, later in life. That's a very important sustaining bond. On the other hand, if people are in the same room and 2 seniors get sick, we're gonna have 2 kupuna in the hospital rather than 1. The Department of Health does have capacity at hotels, and needs to use it as much as possible, even if it means thinning out other people from the house. Some of the younger members of the family might go stay at the hotel to be separated, so there's more room for our kupuna to separate into 2 rooms, for example. There's a lot of ways to do that, and that's good too. And then we can, of course, come back and help with activities of daily living and food and so on. Right now, it's going to really be a challenge. We're going to have people wearing our masks, even in the household, in some parts of the community to prevent spread. And I would recommend that if one family member does get sick, then I would have them wear a mask 24/7 when they're resting, and they can take it off when no one else is in the room with them, but then always should be mask to mask if someone's been sick. That decreases the rate of transmission, we're told, down to 1.5%, which is very good. If someone is fulminantly sick, they're going to be in the hospital, of course. So that takes that burden off of the family.
And you mentioned the possibility of maybe our keiki going to stay somewhere else to try and protect the kupuna. Do we know what percentage of those with no known health conditions are getting severely ill, particularly speaking of minors?
Yeah, it's almost zero. It's like if you look at keiki or people under 20, a lot of them are kids, with 0 health problems, it's once in a blue moon someone ends up getting so sick that they have organ failure or die. Even up until about age 50, if there's no underlying health problems, people are sailing through this. As soon as you add comorbidities, it becomes trouble. And of course, as we get past 60, 65 years old, we also start seeing the mortality rate bump from like the low single digits for severe illness up to 8.5%, and then it goes over 14% when people become elderly at baseline. If you add chronic disease, especially lung disease, the numbers get very high. Also, we've found that people with high body mass index seem to be more susceptible. That's probably diabetes and a poor inflammatory response and immune response. So that's the mitigating problem. But there's still so much to learn about this disease that the best thing we can do is do mass prevention. We've talked about that a lot. And we are prepared to treat people in the hospital. We have already, though, begun to have a shortage of remdesivir, but we have more than enough steroid, which is, one of the main treatments. And then we can treat people with other modalities, but also the plasma stockpile has also dwindled. So it's becoming more difficult. We've gone from a point where we got to 91% of all of our people that had been cleared with the virus. Now we're down to something like 53% because of the big surge. So we have 1,334 active cases out of the 2,763 cases.
And we've been hearing in the news a lot about like the Micronesian and Filipino communities and how they've been disproportionately affected. How can we support the health of these communities?
Well, one thing we can do is really advocate for them to be able to have some additional housing during this crisis to spread out. We should go out into the community with people who have language skills and make sure that they understand the need to be screened and tested if it comes to that. That they are not, if under any circumstance, they are not going to be reported to immigration, or if there's any concerns within the family whatsoever. Although these are all legal immigrants, but a lot of people still have some relatives that have found themselves in hot water, that they will not be subject to any kind of law enforcement consideration. These are kind of the common, I guess, concerns we hear from people, especially people from minority communities or immigrant communities. But our numbers are high. It's over a third of all people, of all the cases, have been from the Pacific Islands. And that's setting aside the Hawaiian community. So I've been asked to express this in terms of Native Hawaiian and Pacific Islander, although the definite cohorts within the Pacific Islander community have had varying degrees of infection. It's hitting everybody, but it has hit the Micronesian community the hardest of late.
And getting down to some of our last few questions, but how do you respond to those that are skeptical of the various mandates? And it sounds like we're going to have more mandates coming down in the next day or two. So how do we respond to those that are skeptical, as well as how do we engage people where they are to validate their concerns as we share our understanding of how the virus creates disease and also disability?
Well, we should be compassionate and understanding if people have differing opinions. If someone invokes the civil rights argument that we have inalienable rights, we also will express the need to care for everybody and to prevent disease for everyone. We're in a closed society now that has us all dependent on one another. Some of those arguments are specious, because I know that on the one hand, someone's arguing that they don't want to listen to the rules, but at the same time, they're perhaps on Medicaid or they're receiving Social Security benefits. I mean, we are already a part of a singular societal organism, and you don't get to opt out of one and not be responsible for the other. So you really can't take in state services or roads or public hospitals, and then the flip side, refuse to follow the rules of the very state that offers them. That is a hypocrisy that I can't accept. So, but still very understanding. I know how much people hate being locked down, and I have conservative friends who feel strongly that we should let the virus roll over us, and then emerge later with immunity. But that would have necessitated watching a mass casualty event right in front of us. Probably 4,400 to 4,500 people would die. That's our projection if we just completely let the virus roll through Hawaii. And I'm certainly not going to let that happen to my relatives or yours. So can't go there policy-wise.
Mm-hmm. And now many are concerned about the lack of communication from the state on having a clear plan of action on when to self-isolate versus going back to work. One question is about possible exposure and trying to get tested. So what should we do in these types of situations when we're expected to do one thing, but told to quarantine or stay home, but maybe we have a doctor's note? So how do we handle these situations?
I know it's pretty challenging because a lot of it feels like it's being kind of thought up and rolled out on a whim. A lot of work is going into it, but this is a new pandemic, and there's been a lot of negotiating and kind of collegiality between the city and the county and the Department of Health and the governor's team. I'm not gonna lie to you, I would have handled it very differently. I would have handled it with input from all, but organized from the top and centrally, because not because the governor is better. You can designate whoever you need to manage the entire crisis, but people have to have a clear understanding of what is expected in a pandemic, and the things are fairly simple. A 6 to 8 week full-on mitigation process with social distancing, mask wearing 100%, hand washing and staying home and avoiding groups of 10 when outdoors, that does it. Takes the whole thing down. And you can do that. It would require a bit of an extra enforcement, and that's really what we should do and should have always done, and then allowed tourism to come with a test, maybe even a second test. If you really wanted to go the extra mile, can be accommodated, and quarantining individuals. That would utterly end the virus and this pandemic for Hawaii. It's difficult because the governing is occurring across a large number of people. It's kind of Hawaii style. I'm not going to lie to you, but there does need to be a little bit more strong centralized leadership for this kind of circumstance, because I know how confused people get.
So thank you so much for answering those questions. And in our last few minutes with us, what do you want to leave with our viewers today?
Well, you have many hundreds of people on this call and leaders that are healthcare people that are trusted. A couple things. Each of you should take to heart whatever you think is most valuable and spread it wide. It's obvious that if we physically distance and wear a mask, that we can suppress the virus. That is completely clear. And everybody should be encouraged to do that. Everyone should follow the rules and not have groups of greater than 10 indoors or out. There may be a new order today, which will even further enhance what we have to do as far as restrictions. But if you could do that, it would be good. I'm happy to communicate things every day to people. I know that a fair number of people are following our social media, but let me give you information every day. It's social media is at LTGovJoshGreen, at LTGovJoshGreen. So every day I can give you the updates and you can share best practices with people. And my cell phone is 937-0991. If people have an emergency, they should text me. For basic questions, it's not really useful because it's just, I can't get to everybody, unfortunately. But for an emergency, if you say that, I will get to it. And I would like people to share best practices. We are we're the health leaders after all. This is a public health institute, right? And so it's incumbent on us to get the best information out to people. Some people will listen, some won't, but give them a little data. They're going to respond quite well. And more than just that, this is a time when the world's learning that it's connected, and you can see it in real time. So hopefully people will be introspective about this experience and take that to heart, because now that we see how connected we are and how we can all go down easily, that should argue for a better environmental health policy as we go forward. It should argue for better smoking cessation policy as we go forward, knowing what the impact of secondhand smoke is. It should go a long way when we talk about finite healthcare resources, but the ability to use prevention and decrease costs while increasing services to all. All of these things are very relevant lessons from an era where a global pandemic could take down some large percentage of us. So I hope people will start thinking about that. If they do, we're going to come out of this with some valuable lessons that were worth it. I've heard people say that this will be forgotten quickly. Well, it may be forgotten, but it can be instructive. So I hope that all happens, and please forgive me for just having to give you only 80% of the picture today, because you're going to see a pretty large 20% of the picture coming in the next 24 hours. But I'm happy to share more later. Certainly the updates on my social media will reflect exactly what the orders are, and so people know what's coming without having to endure a 90-minute press conference or whatever, or interview. I'll do that for people. And just please be safe, everybody. You guys are our present and future healthcare leaders for the state. We need you here. I want you to succeed, and I want public health to be at the front of everyone's policy and kind of front of mind when we go forward. So I'm just appreciative of you, and thanks for including me today.
Well, we cannot thank you enough for being here and sharing all of your thoughts with us. So mahalo for taking time today to be with us, and we look forward to your daily updates on your social media.
Thank you, guys.
Thank you.
You bet.
So to all attendees, before we wrap up, we do have some resources that we would like to share with you folks. So as a reminder, the Hawaii Public Health Institute has COVID-19 resources and information available. And I apologize, let me go back to the slide that is up on your screen. Apologies again if we did not get to the questions that were submitted to us. If you are interested, please submit those questions to covidexemption@hawaii.gov. Again, that email is covidexemption@hawaii.gov. As I was mentioning, that we have resources available on the HIPHI website, and they can be found at hipi.org/COVID-19. You can also find links to our COVID-19 webinars from the past there, as well as on the Hawaii Public Health Training Hui's YouTube channel. We know that there are many unknowns right now, and we know that we all have a role to play in mitigating the spread. We do want to encourage you to wear masks in public settings and when around people who don't live in your household. Don't forget to continue your social distancing as well. As much as possible, we want to stay home and limit our trips to the store and being outside. And of course, remembering to wash our hands for at least 20 seconds. We feel that if you are able to implement some of these, if not all of these, then we can help mitigate the spread. We also want you to stay aware of your health. It's our responsibility, if you are not feeling well, to self-quarantine, as well as acknowledging that COVID-19 has a range of symptoms. As LG said, there's so much that is unknown about COVID, and the best thing we can do right now is focus on prevention and do what we can. So again, I just want to thank LG for being our guest today. We want to thank all of you on Zoom for attending our webinar. I would like to thank the other HIPHI staff behind the scenes, making sure everything runs smoothly. Just a reminder, we are hosting our webinars every other week, and we are still confirming our topic for Wednesday, August 19th. But please save the date, Wednesday, August 19th from 1 to 2 p.m. for our upcoming webinar. And mahalo for being with us today. Please stay safe and be well, and we hope to see you on our next webinar. Aloha.